What we're actually treating is the left prefrontal cortex of the brain. We're seeing lack of blood flow to this area of the brain where we think it's impacted by depression. With this magnetic impulse that we're sending to that area, what we're seeing is increased blood flow to that area and ultimately alleviation of the depressive symptoms.
When you sit down for transcranial magnetic stimulation, the probe will be placed on your dorsolateral prefrontal cortex. It's an unusual feeling, like someone tapping on your head, but it's not painful. Some individuals are a little bit more sensitive to it than others, but in general, it's fairly well tolerated. So you're receiving good therapy, you're eating healthy, you're doing these things to help your depression get better with the support of Roger's team. At the same time, we're activating a part of your brain that has been dormant for a while, likely contributing to your depression. And when you do healthy living, psychotherapy, and you're waking up this part of your brain through the TMS, you have a better chance of feeling better and overcoming the depression. So it's important in our view to make sure that you're not just relying on transcranial magnetic stimulation to help you feel better, but you're doing some of the other things necessary to get the improvement.
The initial session that the patient will come in for is actually called the motor threshold determination, but we call it the mapping. And that is where the attending physician will come in and actually determine the treatment location on the patient. The mapping involves using single pulse stimulation over the motor cortex to stimulate the right thumb. Once we get that involuntary response in the right thumb, we know that we're in the general vicinity. The attending physician will then move around slightly millimeter by millimeter until we pinpoint the most precise location. From there, we determine how much energy is needed to actually penetrate the skull and the skin and muscle to hit that location again and get the same response. We move into treatment location and we perform the first treatment. The patients following treatment start with the TMS technician going over a couple of review questions. You know, how did you sleep, any pain, discomfort from previous treatments, etc. After that, we get the patient set up, make sure they're positioned correctly. Then we actually place the treatment coil on the scalp. Treatment now is only 18.5 minutes. We recommend 30 treatments, which would be considered a full course. Treatments are Monday through Friday, 5 days a week. Treatment's done, we take the patient out of treatment position, and they are good to go.